So, the sciatic nerve is formed by two nerves, the tibial, which is having the anterior division of the ventral primary rami of the L4, L5, S1, 2 and 3. The other is common peroneal, or also known as the fibular, which is having the posterior division of L4, L5, S1 and 2. The ventral primary rami of these all four by its posterior is having the common peroneal, which is also known as common fibular nerve. This nerve comes out from the greater sciatic foramen below the piriformis muscle. Sometimes this muscle compresses the sciatic nerve, which can lead to a clinical condition, painful condition for the lower limb known as sciatica. Nerve is running beneath the gluteus maximus muscle, but when it descends downwards, it is covered by the long head of the biceps. Here we can see the long head of the biceps, and it is running on the obturator internus, the gemellus superior and inferior, quadratus femoris, and finally it is running on the adductor magnus muscle. The fourth muscle of the region is adductor magnus, simply the hem part of the adductor magnus, or also known as the posterior compartment or ischial part of the adductor magnus. When we see this muscle, taking origin from here, this is adductor part. A thick rounded part which is taking origin from the lateral part of the lower triangular part of the ischial tuberosity. Medial part is the part of the ischial tuberosity where we sit. So, this part taking origin from here, running downwards and insert it on the adductor tubercle of the medial epicondyle of the femur. It is just about 2 millimeters above the medial epicondyle of the femur, known as adductor tubercle. The remaining fibers of the adductor magnus, which is the muscle of the adductor compartment, fibers are taking from the inferior pubic ramus and ischiopubic ramus. Inferior ramus of the pubis is forming the ischiopubic ramus, with the ramus of the ischium. Fibers which are taking origin from the ramus of the ischium fans downwards and laterally to be inserted on the femur, but fibers which are originating from the pubis, the inferior pubic rami or ramus, are running horizontally to be inserted on the femur. This part of the muscle is also known as the adductor minimus muscle, but here we will talk about only ischial or ham part of the adductor magnus muscle. This muscle is also showing 5 openings for the branches of the profunda femoris artery, or also known as deep femoral artery. Deep femoral artery. These openings are having the branches of the profunda femoris or deep femoral artery. And fourth branch of this profunda femoris is also considered as the continuation of the profunda femoris artery, or also known as posterior femoral or deep femoral artery. But fifth one is the largest one, and it is osteoaponeurotic opening known as adductor hiatus. So this part is known as adductor hiatus. The femoral vessels, the femoral artery and femoral vein, are leaving the medial side of the thigh or the adductor canal, which is also known as the Hunter's canal. This vascular bundle is leaving the adductor canal and entering in the popliteal fossa through this opening, through this adductor hiatus. So this is the fourth muscle of the region. This muscle, the ham part or skill part of this muscle, is also extends this hip joint and flex, prime mover for flexion of the knee joint. So these are 4 muscles of this region and the one nerve. The other nerve is the posterior femoral cutaneous nerve, which is a branch of the sacral plexus running with the sciatic nerve, superficial to sciatic nerve. After taking the median course up to the upper border of the popliteal fossa, it becomes superficial and cutaneous and innervates the posterior part of the leg. So this was the anatomy of this ham region or posterior compartment of the thigh.